So, my father was an incredible man. He was my inspiration. He was my role model, my mentor, my softball coach. My kids called him Poppy. And sadly, he got sick. He was diagnosed with primary progressive aphasia, which causes the part of your brain responsible for communication to break down. He eventually lost his ability to communicate altogether, to speak, to write, to understand any language. This was really hard to watch. But there was joy. He knew who his kids were. He would hoot and holler and sing and dance to show his love. My dad was a fighter, and we loved him so much. And then Poppy had a seizure, and it thrust us into our country's complicated and frustrating healthcare system. So let me try to visualize for you this labyrinth of an experience. So first, we went to the hospital, and a rehab therapist threw a ball to him every day. But unfortunately, they never helped him walk. And when he was discharged, my mom voiced her concern that he would fall when he got home. But it didn't matter because there was no money left. And when he got home, he fell. And so we had to take him back to the hospital. We then learned that a rehab facility would take him for up to 12 days. Maybe this was our way home. It wasn't. It got even more chaotic from here. And some of you probably have experienced something like this. So, as a veteran, my dad was on the wait list for a new veterans home, but the construction was behind, so that was off the list. We then found a senior living facility, but they couldn't take him because he needed a clinical babysitter. So we then called several skilled nursing facilities, and they couldn't take him because they would only if he was in hospice. So then we called hospice, and hospice said that they would come to evaluate him and needed to coordinate that with the case manager. Well, the case manager position at the rehab facility was vacant. My mom asked if she could please sleep in his room overnight because he can't communicate. The answer was no, because overnight stays were only allowed for patients in hospice. You know, my dad knew who we were on the last day of his life. He smiled at me, and he blew a kiss to my mom, and then he died alone in his room in the middle of the night, and we will never know what happened. Have any of you ever experienced something like this? You know, I'm an architect. I've been designing healthcare spaces for 27 years. I thought if anybody knows this system, it's me. And I couldn't have been more wrong. I was totally helpless. And it made me so angry. But it also changed my perception. Architecture alone is not enough. Today, I believe that stories have the power to transform healthcare from the inside out. My dad's story, your story, all of our stories. You know, as an architect, I was trained to see the object, all while believing as the master builder, I know how to design for you. And in healthcare architecture, we're typically focused on function and efficiency. Well, this made for an experience that was impersonal, lonely, and frightening. Even the grieving room, where we learned of my dad's death, had no windows, uncoordinated furniture, and literally had supplies stashed in the corner. This was not designed for us. I knew that we could do better. I realized that architects have to do more than make. We have to observe and listen. We need to connect with what it's like to be you. We have to do the hard work of designing experiences that resonate with each and every one of you and with the people you love. Because if we're not designing with your stories, you know, we're designing for everyone and no one at the same time. So I set out to find healthcare organizations who shared in this belief, who wanted to embrace that human experience. And for the last 4 years, we have talked to hundreds of patients, loved ones, clinicians, and we have learned the most amazing things. And you know, it's given me faith that these stories can make healthcare more empathetic and more dignified. So I'm going to start in kind of a sad place, but I have a feeling that a lot of you have shared this experience, and it's about cancer. cancer is the second leading cause of death in the United States. Since I stepped on stage, likely 19 people have been diagnosed with cancer. How many of you have been touched by cancer? Yeah, look around the room. It's almost everyone. Yet spaces still struggle to support even the most fundamental patient needs, like psychological safety. Patients want to feel safe and secure so that they can heal and recover. Our journey took us to places like the University of Chicago Cancer Center and Memorial Sloan Kettering, both looking to transform patient experience. And through 80-plus hours of interviews with over 150 patients with cancer, we asked lots of questions like, what does belonging mean to you? Or what does an exceptional experience feel like to you? And across hundreds of pages of notes, we began to understand patients' expectations, their fears, their emotions. So I'm going to share some of these stories with you, and then I'm going to share some ideas. Stories like the blur of finding out that you have cancer, or the incredible anxiety associated with that first visit to the hospital after you find out you have cancer, or even the desire to control something because you've lost control of your fate. So let's start with reducing that anxiety when you first come to the hospital. So imagine you arrive at a world-class cancer center, renowned for its incredible cancer care. You step into the lobby and you pause, not because the beauty captivates you. You pause because you feel numb. Everything is a blur. We have heard consistently from patients about the incredible anxiety associated with that first visit. Patients are in fight or flight mode. Fear and anticipation rules their emotions. And you know what? We navigate space with our emotions. So what could we do to break through that blur? Maybe it's the greeter who actually greets you in your preferred language. Or it could be that the destination is so obvious and so easy to get to. It could be as simple as a strategically placed bench to stop, rest, and breathe. When we listen to your stories, these are the simple things that patients are asking for. We also know that patients often have to navigate sprawling, complicated medical centers, all while piecing together their treatment plan. This is exhausting. Why can't we bring the campus to you? Imagine a comprehensive care hub. Think of it as a one-stop shop, all the way from healthcare insurance to treatment plan. The space is personalized for you. There's space to breathe and there's space to listen. You can be as big as you want or as intimate as you need. And all the technology that you need to get you to that action plan right away is there, right there. And imagine, even the entrance is dedicated to new cancer patients, providing you with that psychological safety that you desire. This is the kind of design ideas that can take us from blur into clarity when we listen. Imagine losing control of your future. One patient told us a story about how she thought cancer was the end of her life, and all of the comforts around her were there only to appease her. Well, they were there to comfort her, but it was one size fits all. So we've got to do better. You know, what if we could give control back? We could make a customizable patient room where you can move furniture and create areas of quiet. You can control the temperature of the room. You could control a sound masking bubble that would allow you to sleep while the staff still does their work. This technology is coming. This is the bold ideas that emerge when we are listening to people's stories. And of course, we know that we need to also see the whole picture. So we've got to talk to our nurses and clinicians and listen to their stories because they are our heroes, after all. Yes, thank you. So nurses. We have consistently heard from nurses that sometimes they need to take a breath right now to recharge. This may seem obvious, but the spaces that we are providing nurses today are not what they need. So imagine with me that you are a nurse, and you, the nurse, have a patient named Sarah, and she is fighting for her life. You two build a bond together, and you fight together And then Sarah dies. You hold it together. You provide comfort. You do not cry because you don't want to take away from the grief of that family. And when you step into that corridor, you are about to explode. Our nurses today are taking that breath in the bathroom, in the locker room, in the stairwell. We know that we can do better than that. What if we could create a space that was flexible and allowed you to be as vulnerable as necessary in the moment that you needed it? It could be controlled acoustically and visually. You could turn on ambient noise to reduce stress, change light levels and color temperature to promote calmness. This is the kind of space that nurse needs so he can recharge for his next patient and so he can recharge for his family when he gets home. Because let's not forget that nurses are human too. So, we are making progress. There are cancer spaces that are being designed and built today that have been influenced by this research. But there's also organizations outside of cancer who are doing amazing things. So I want to share with you two, one in maternal care and one in dementia care. So the maternal death rate in the United States is the highest among high-income nations. For Black women, it's 2.2 times higher. One Black woman told me the story of losing her baby. Her grief was met with fear by the care team, and they called security. This woman needed compassion and a safe space to grieve. For God's sake, we can do better than that. Yeah. So there is one incredible woman named Okunchola who has created the Jama Birth Village in Ferguson, Missouri. This village provides midwifery care, and it honors cultural beliefs and values. The design provides joy and also provides extended postpartum care, critical because nearly 2 out of 3 maternal deaths happen postpartum. The village infuses West African culture and helps the moms be understood and see themselves in their care. And the work she does reminds me of how much of the world is designed for women, but not designed by women. I think that we need to start listening to our own stories. Design a more inclusive world. And I would suggest that we start with redesigning the mammogram. Who's with me? Yeah. And for those of you who are not laughing because you have no idea what I'm talking about, just ask a woman over 40 about the pancakes. Okay, so there's one more place in the Netherlands that is revolutionizing complex dementia care. It's called the Hogewijk Dementia Village. They provide familiar places with everyday activities in a safe community. The care team wears regular clothes, fostering normalcy, while still providing skilled nursing through hospice care. The design creates unique settings that become familiar for the residents and promote dignity. The model destigmatizes dementia and integrates it into society safely. We can change institutional care to something that is inspiring and inclusive and allows you to have dignity in life and in death. If my dad had had a place like that, we know he would not have died alone. Your stories are essential to making the best healthcare experiences. In fact, any experience. Design is an advocate for you. I am no longer a designer. I'm now an advocate who designs. Now you may all not be designers, but you can all be advocates. Be an advocate by volunteering for places like Gilda's Club, who's trying to make communities stronger than cancer. Share your story, even if it's painful. The first step towards change is exposure. Advocate for a community that's been overlooked. Amplify their voice. Maybe we could just listen to each other. You know, our shared humanity is a collection of our lived experiences. These matter. I know that we can be better because we can be advocates for each other. This is the world that I'd like to live in. Thank you.